Hello, this is Dr. Ammar. This is the first lecture in the cardiology series, which will begin about the anatomy of the heart. Any question you can email me here at ammarabajami@gmail.com. The heart is composed of 4 chambers, 2 atria and 2 ventricles. The atria are low pressure capacitance chambers. Their function is mainly to store blood during ventricular contraction. So when the ventricles are contracting, they are storing blood, and to fill ventricles with blood during ventricular relaxation or ventricular diastole. Now, the ventricles are high pressure chambers. Their function is pumping blood. The right ventricle is to pump blood through the lungs, whereas the left ventricle is to pump blood to all other peripheral tissues. Note you should know, the most anterior chamber of the heart is the right ventricle, whereas the most posterior chamber of the heart is the left atrium. Normal heart and chest X-ray. The heart occupies less than 50% of the transthoracic diameter. The heart occupies less than 50%. If it is more than 50%, it is considered cardiomegaly. Cardiac borders, left cardiac border and right cardiac border in chest and heart X-ray. The left cardiac border is formed by the aortic knuckle, the pulmonary trunk, the left atrium, and the left ventricle from above downwards. So the aortic knuckle, the pulmonary trunk, the left atrium, and the left ventricle. Whereas the right cardiac border is formed by the superior vena cava and the right atrium. The blood supply to the heart. We have the left main coronary artery and the right coronary artery. They are branches from the aorta. They arise from the left coronary sinus and the right coronary sinus, respectively. The coronary sinuses are just distal to the aortic valve, so we have left main coronary artery and the right coronary artery, branches from the aorta. They arise from left coronary sinus and the right coronary sinus. The coronary sinuses arise just distal to the aortic valve. The left coronary artery gives the left anterior descending artery and the circumflex artery. The left anterior descending artery supplies the anterior wall of the left ventricle, the anterior part of the septum, and the apex, whereas the circumflex artery supplies the lateral wall of the left ventricle. Now the right coronary artery. It supplies the right atrium, the right ventricle, all of it, and it continues and rotates backwards to supply the inferior and posterior wall of the left ventricle. The supply of the heart. The heart is supplied by sympathetic and parasympathetic innervation. The sympathetic, it supplies the atria and the ventricles. The atria and the ventricles, and the P1 receptors predominates in the heart with positive inotropic and chronotropic effects. Now the parasympathetic innervation. It supplies the atria only, where you can find in books as a vagal escape, with cholinergic supply from the vagus supplies the atria via muscarinic receptors, and under basal conditions the vagal inhibitory effects predominates, resulting in slow heart rate.